my hands. I'm going to check my MAR to my order as I always do. I have Mr. John Smith, and his birthday's XXXX. Same MR number, he's in room 1. It looks like I got the same patient here. It is 8:30 in the morning, so I'm giving, looks like I'm giving heparin. That's the only thing scheduled right now. So I have heparin, 5,000 units, sub-Q daily. Heparin, 5,000 units, sub-Q daily. Okay, it looks like the aura and the MAR match up, so I'm indicating here, so far that's the one I'm going to choose to give. I'm now going to make sure it's safe to even give this medicine, so I flip it over. On my labs for heparin, I'm looking for what? PTT, and if I have it, and then otherwise platelet count, right? So for my PTT, it's 28 seconds, which is in normal range, and then I have a platelet level of 185. So both of those are normal. So again, I'm still continuing on safely to give this medicine today. So I'm going to get it out of the drawer. So I have Mr. John Smith's drawer. It looks like I got it here. Heparin, 5,000 units per 1 ml. It's not expired. Okay, so I'm going to go ahead and get rid of that since I'm done using that order and just do my first check. Heparin, 5,000 units. Here it's per 1 ml, so I'm going to give 1 ml. Sub-Q daily at 9 o'clock, and it's not expired for Mr. John Smith. Okay, that was my first check. I'll just clean them again to be safe. I'm going to go ahead and draw it up now, so I have to have my gloves on since I'm getting it out of the vial. Before I put that one on, let me see. I've got my needle and syringe connected here. This one is actually says it on the end here, it's 25 gauge, 5/8. So I'm going to get it out of its packaging. Just as before, I will need alcohol to clean my vial. So I'm going to scrub the hub of this, let it dry for a second while I get some air into my syringe. Today my dose is 5,000 units, and that's per every 1 ml. Take off my cap. I'm going to instill that 1 ml. Invert my vial. Pull down on the plunger until I get all the air out and the medication into my syringe here. Okay, so I'm going to ask this nurse, could you please verify what I have here?
You have 1 ml of heparin.
I have 1 ml of heparin. And I'm going to just let you know and show you that that's what's ordered today is heparin 5,000 units. And it's due now, and it's safe to give my patient because the lab work is safe. Okay, so now I've verified that with another nurse. I'm going to scoop method and get my cap back on there. And now that I have that in the syringe, I cannot leave it there without being labeled, so I don't want to forget or mix it up with anything. So I'm going to make sure I label it. And most importantly is the medicine name, so heparin, the dose, 5,000 units, and it's for Mr. John Smith in room 1. The room isn't as imperative as the other 3 things. I'll tape it here to my syringe. All right, I'm now going to do my second check. I have Mr. John Smith. It's heparin 5,000 units, and that's 5,000 per 1 ml. And I've got 1 ml here. I also have his name and his initials on here, and we're giving it sub-Q, and it's due right now at 9 o'clock. Okay, so I've got everything prepared and ready to go. I'm gonna remove my gloves, and I would throw them away. And now I'm going to go to the bedside. So knock, knock, knock. Hi, Mr. Smith. My name's Deidre. I'm here to give you your medication today. How are you?
Good.
Great. Can I get you to please tell me your name and birthday so I can compare and see if I have the right person?
Yes, John Smith, XX.
That's correct. Okay, let me check your band too. John Smith, XX. Do you happen to have any allergies?
No, ma'am.
Okay, great. That's perfect. So today, just so that you know, I plan to give you heparin. Heparin is an anticoagulant. It's going to thin your blood and prevent blood clotting since you're, not walking around as much as you have been, okay? Does that sound good to you?
Yes.
Okay, before I begin, I need to do one last check. So I'm on my third check. We've identified Mr. John Smith. He's getting heparin. It's 1 ml in here, and per every 1 ml, it's 5,000 units. Okay, and that's due right now for you, so that's ready to go. Where was your last injection site?
On the left side of my stomach.
Left. Okay, then if you don't mind, I've got to rotate around, so I'm going to go right over here on the right side. We have to go in your abdomen with heparin because of the type of medication it is, okay? So I'm going to start by in the center and just clean outward. It might be a little cold. And then I'm going to leave that kind of there just to give me a little idea of where that landmark is while I grab my syringe. Because you're just roughly, 170 pounds, I'm going to go ahead and go at a 90-degree angle. I'm going to squeeze, and I'll count to 3 and inject. 1, 2, 3. Okay, inject my medication, very just slow and easy. I'm going to count down here, 5, 4, 3, 2, 1. Coming out and straight into the sharps container. All right, any little blood droplet, I could just kind of gently wipe with the alcohol, or even better would be a little piece of cotton ball. Okay, so in 30 minutes, I'll come back and just check that injection site to make sure there's no bleeding or bruising. But otherwise, is there anything I can get for you?
No, ma'am.
Okay, I'm gonna leave you in the lowest position and with your call light for safety, and I'll be back, like I said, in 30 minutes. Clean my hands, and then I'm gonna come out and chart. And as before, we gave the medicine, so a line through it, your initials and your signature at the bottom, and then we're done.